Hi, I'm Dave Roddenberry, Director of Veteran and Military Programs at the Governor's Institute. And today we'll examine the unique challenges faced by veterans as they navigate this military to civilian transition process. We'll explore the psychological perspective of transition, pitfalls to be aware of, strategies for resilience, and the crucial role that we all can play as providers in supporting our veteran clients during this important phase. We'll also discuss the impact of transition on spouses and children as they navigate the journey alongside their veterans.
I just think that a lot of veterans feel misunderstood. I think it's a stigma too that you shouldn't ask for help. You're supposed to be strong, same with mental health when it comes to veterans. So I think for so long I was so embarrassed and tried to hide it, and then when I got help, it's like it set me free. I didn't have to be embarrassed anymore. So I will tell my story as many times as I can if it helps save another person. Like, I will do it forever. My name is Jessica Case, and I'm a U.S. Navy veteran, and I live in Black Mountain, North Carolina. I'm a single mom of 3 boys. My soon-to-be 14-year-old is a wild child. Easton, the 10-year-old, is all into basketball, really likes to cook steak, and he actually does pretty good at it. And then Noxon is 8, and he is my baby. Overall, they're great kids. I've been very blessed with great kids. Every choice I make is because of my kids. I was stationed on the USS Ronald Reagan and the USS Nimitz in San Diego, California, and I did 2.5 years and got injured. When I moved back, I met my 2 youngest dad, and we were together for 10 years, and due to substance use and untreated mental health, he was very abusive. I was to the point where he was kicking me out with 3 children, and I Googled, single mom disabled veteran, help, and I called this 1-800 number, and Brandon answered the phone.
I'm Brandon Davis. I served in the U.S. Army from 2003 to 2012, and I worked for Veteran Services of the Carolinas, and specifically the program NC Serves. NC Serves currently serves all 100 counties of North Carolina. We believe that looking at healthcare as a total package is someone's overall health is what will ultimately drive success going forward. I believe what makes me good at my job is that I've been there. I have been homeless. I've been without a job, looking for help and being unable to find the resources that were out there. I spoke to Jessie the first time on the phone. She had been told by her ex that she wasn't eligible for anything, and there wasn't anything out there for her. So I made it my mission to ensure that Jessie knew exactly what was out there for her, that she could in fact get benefits. She could find a career and purpose again.
Obviously, at first, it seemed too good to be true. All the gaslighting that, makes you feel crazy. So I'm calling and asking for help, and to have somebody that actually is like, okay, yeah, let me help you and believe you. I mean, it's pretty awesome.
NC Serves is unique because when you call our coordination center, You can expect to either speak to a veteran themselves, a family member of a veteran, or a trained mental health professional. We only want to help you achieve overall better health and ensure that you and your family are safe and healthy.
And I feel like from then on, it was just adrenaline. And I don't think I've stopped since. It was everything that I could do to improve my life and to improve my kids' life. So now I'm a peer support specialist for Veteran Services of the Carolinas, and I go to school at Mars Hill for social work. I want to help veterans in any way I can.
We often tell our teammates that we will never talk to somebody on a good day. The power shut off. There's no food in the house. If you're in need of help, please don't hesitate to call us. We're all brothers and sisters in arms. We're all here to support you.
Have you or a loved one ever served in the armed forces? NC for Vets is a one-stop shop for veterans to find the help they deserve. We have services that help with housing, healthcare, education, and a lot more. Learn more at ncforvets.org.
Hi, I'm Cindy Greenlee. I'm a psychologist and I work at the Durham VA Healthcare System in the Department of Mental and Behavioral Health Services. And today I'm talking about anger management and de-escalation. So what is anger? Anger is an emotion that we all have. However, for some, it can be very frequent or very intense or even harmful. And we recognize that, yeah, it's okay to have emotions. And if it's harmful or frequent or intense, it might be helpful to learn good strategies for managing it. So there are a lot of theories about where anger comes from, but there are two common things within these theories. First is that anger doesn't come out of nowhere. There are often some preceding emotions to the anger, which is also an emotion. So the preceding emotions tend to be things like fear or anxiety or frustration, which some people describe as like helplessness, but then also anger, or even feeling attacked or threatened or kind of backed up into a corner. Those are emotions that, when experienced, may lead to anger in the near future for some veterans. So that's preceding emotions. We also know that how we all interpret things can affect how often we experience anger. For example, people can be in the same exact situation, both be driving down the same highway at the same time, and have different experiences of that event. So for one person, they get cut off in traffic and they're honking the horn, cussing and fussing all the way down the road. And they're late to their appointment, they show up, they're out of breath, they're upset with their providers, they're upset at everyone they see. for the next half hour or several hours. Whereas someone else could be driving down that same highway, get cut off in traffic, get frustrated, that's normal, but are able to move past it and go to their appointment no problem. So we want you to be mindful of the fact that sometimes how we experience things affects our emotions.
Attention, carry, colors, ready, cut, forward, march. Colors, halt, right wheel, march. Forward, march, colors, halt, present, colors.
Please join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Carry, colors, ready, cut, counter march, march. Colors, halt, right, face, forward, march. Colors, halt, fall out.
Thank you, everyone, and welcome to Mecklenburg County and to the NASCAR Hall of Fame. My name is Crystal Miller, and I'm the Veteran Services Supervisor for Mecklenburg County. I hope you all had time to see the exhibitors and time to network. And at this time, would you please rise for the presentation of the colors, followed by the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you to the color guard. Let's give them a hand. Today, our meeting is dedicated to all of those who have had to experience the tragedy of suicide. We do everything that we can in our daily jobs to advocate for better mental health services for our veterans and for their families. Here to welcome us today, oh, everybody be seated, sorry. Here to welcome us today is Chairman George Dunlap. He was first elected to the Mecklenburg Board of County Commissioners in 2008. Chairman Dunlap served 14 years as the District 3 representative for the Charlotte-Mecklenburg School Board. He formerly served as chairman of the county's Effective and Efficient Government Committee, a member of the Public Safety Committee, a member of the Economic Development Committee, and as the liaison to the Mecklenburg County Fire Commission. He is a former DARE officer with the Charlotte-Mecklenburg Police Department. Chairman Dunlap received his master's degree in public education administration from the University of North Carolina at Charlotte in 2003. He received a Bachelor of Science in Criminal Justice from UNC Charlotte in 1991. And Chairman Dunlap is a Marine veteran. Welcome to the stage.
Well, first of all, good afternoon. You know, it's sad when it takes longer to read your resume than it is the words you have to share. So we need to work on that. We're going to have to work on making that a lot shorter. I have the distinct honor of serving as the chair of the Board of County Commission here in Mecklenburg County, and I do so because of my colleagues. And people sometimes don't understand that in various communities, there are different forms of governance that leads to who chairs the commission. And in Mecklenburg County, our process is that the person who receives the most number of votes from their colleagues become the chair. And so we have a 9-member board, and you need to be able to get 5 votes. So we know how that works sometimes when you can't get the votes. But I'm privileged to say that for the last several years, I've gotten most of the votes. I've now served my 5th term as chair consecutively. So I acknowledge my colleagues. I want to take this opportunity to bring greetings on behalf of the more than 1.1 million citizens who call Mecklenburg County home. It's where they work, where they play, where they enjoy life. And among those who call Mecklenburg County home are our veterans. Now, I know that there are people who are more qualified to talk about veterans than I am, and so I'm not going to try to do that. I'm going to let those who have the experience talk about that. But what I will say is that Mecklenburg County commissioners support our Veterans Department, and we support our veterans. And I don't think there's any greater service we can render to this community than to support those who have served and protected us, to support those who, for what I believe, are the reasons that we have the freedoms that we have today. I won't talk about all the wars that our military veterans have served in, but what I will say is that if you are a military veteran and you live in Mecklenburg County, we want to make sure that you receive every benefit that you're entitled to. Whether it's veteran services, whether it's with the VA, whether you need to get compensated for any misgivings you may have had as a part of your service. You know, I'm learning more and more each day how there are veterans walking around who need services, who could get services if they talk to the right person. So we need to make ourselves more visible. We need to spread the word about the services that are being provided through our veteran services. I understand I've met some new people here today, and I'm excited about the fact that we have fresh voices who are up to date on all of the things that are being offered through our veteran services. And so every day I speak to people who, for some time now, should have been receiving services, aren't receiving those services because of their disability itself. You know, mental illness is real. There are a lot of veterans in our community who suffer from mental illness that is service-connected. And because of that, sometimes they just don't have the ability to ask, or they don't have the courage to ask, as if though there's some problem in saying, I need help. What I'd like to see Mecklenburg County and our veteran services do is to be able to say to people, there's no reason for you to be ashamed. We owe you because of what you did for our country. We owe you because of the freedoms that we enjoy. We owe you because you laid down your life for our community. And so I'm here today to simply bring greetings and to say that if there are any shortcomings that our veteran services has today, let's talk about it. Let's figure out what it is that we need to do so that we become one of the best in our country at addressing veteran services. We want Mecklenburg County to be that place that when a veteran says, I want to move, I want to relocate, that they do the research and find out that Mecklenburg County is among the best when it comes to addressing veteran services. So I greet you on behalf of my board. I greet you on behalf of our citizens. And I want to employ you, for those of you who are supporters in whatever capacity you serve, whether you are with another nonprofit organization, do what you can. If it takes working with another organization. So we should be a community where there are no big I's and big U's. We should all be working collectively for the same benefit of our veterans. So thank you for being here today. Thank you for what you do for our veterans each and every day. And thank you for being a part of Mecklenburg County.
Thank you, Chairman Dunlap. We appreciate it, and he is 100% correct. They support us at Veteran Services. They listen, they hear us, they see us, and give us all the tools that we need to serve well. All right, for our executive committee updates, Secretary Gaskin could not be with us today, but we have Deputy Secretary Brian Pierce from North Carolina Department of Military and Veterans Affairs.
Thank you. I won't take much of your time. Chairman, I really appreciate those inspiring words. And frankly, what you're trying to do here in Mecklenburg County is what the department's trying to do through forums like this for the entire state of North Carolina. We want North Carolina to be the state that veterans look to find those resources, to find those needs. And it's organizations like this and forums like this that will really go a long way towards providing those resources and benefits to our veterans community across the state. On behalf of the governor and Secretary Gaskin, who unfortunately couldn't be here today, I want to thank you all for coming and participating, both those here, excuse me, and those here joining us virtually. I also want to thank the Governor's Institute and the NASCAR Hall of Fame. What a tremendous venue. Whoever made the decision to start moving this across the state, I think it does nothing but raise awareness for some of the issues that we're trying to solve in our veterans community. And I say solve those issues because we're all about finding those problems, identifying the problems, whether it be resource constraints, program constraints, and provide those services and resources to our veterans. I was talking to some of our colleagues earlier today, and one of them mentioned that, you know, through some of the training we've done recently and through the outstanding panel, I know we're all going to get a lot of out of. He said, you know, even after the training, I don't think I'm qualified, or I don't really know what the next step is to provide some of those resources to our veterans. And oftentimes, those veterans are in need, whether it be acute or chronic, or maybe just someone to speak to. That's why we're here today, so we can continue to coalesce, collaborate, identify the resources available, and make sure those resources, programs, benefits are getting to one, the area of greatest need, but two, making sure our veterans community writ large is getting the resources, benefits, and programs they need. So again, on behalf of the governor and Secretary Gaskin and myself, thank you very much for participating. I appreciate all our vendors joining us as well. Make sure you get by and talk to them because they're another resource for our veterans community. But I really look forward to the panel later today, and thank you very much.
Thank you so much. Next up, we have Terry Westbrook, Assistant Secretary, North Carolina Department of Military and Veterans Affairs.
Once again, thanks for being here. I have transitioned my role a little bit. My role is now the Director of Policy Development for the department. So a little bit of a change there, but obviously the Governor's Working Group is part of the policy that the department executes. So I am certainly part of and continue to be part of this community that we've developed. Happening now, number one, as you can see, the 2024 Appropriations Act is in place. The General Assembly passed it, the Governor allowed it to pass into law, it took effect, and they're working towards all the things in government that make that work. The big thing for you is that, as always, it's a little bit of a mixed bag. Some things went well, some things not as well, but generally speaking, we're still here. We're still functioning. So we're working on the things that we need to do to address it and stuff of that nature. Something that a lot of you would be interested in, the Veteran Affairs Commission. Most of you know that's been around for 75 years or so. It's an integral part of the way the Department of Military and Veteran Affairs is able to conduct business. Secretary Gaskin is working through a pretty major restructuring of that. A lot of our members have been on the board a long time. They're looking, quite frankly, to try to recruit new members and new commission members, get different perspectives in there. So the Secretary's working on that himself. North Carolina Association of County Veteran Service Officers, as you all probably know also, there are two different major groups of veteran service officers in North Carolina. There's the ones that the DMVA, the state, has positioned in 12 towns around the state, but there's also the county service officers, roughly 93 counties out of 100 have service officers that their county pays for and has on board to do the services. That organization, the North Carolina Association, had their annual meeting last week. They all came up to Cherokee. They went through a lot of training. They got a lot of briefings from the VA, from nonprofit groups like National Veteran Legal Services Program, different organizations that all have the world of veterans in there. So they were all there. They just finished that up. All their guys are geared back up for another good year of working. Finally, on happening now, this coming weekend, for those of you that don't know what it is, a Veteran Benefit Live is a veterans benefits clinic that it happens. The VA shows up, the medical people show up, vendors show up, the veterans show up, service officers. We take veterans from walking in off the street through the process of filing a claim, identifying records, working on that claim, putting them in front of a rating official, getting them a disability compensation rating, and giving them an award of monetary compensation all over the course of this 3-day event. This is an incredible process. For those of us in the center of it, we know how it is, but we're going to see 1,000 veterans in Wilmington this weekend. We're going to file hundreds of claims. We're going to get awards. We're going to have, roughly $500,000 or more of compensation awarded this weekend. So this is compensation that comes into the state of North Carolina. This is economic impact to the state. This is dollars that the North Carolina State General Assembly did not have to budget to show up in the state as part of the way we do business. It's also income for veterans that might not have had this amount of income in their lives. This is a life-changing, life-altering event for a lot of people. Wilmington is the fourth one this year, fourth or fifth? Fifth one this year. We had it in High Point. We had it out at Dare County, Nags Head. We had it at we had one in Cary, which we always have. We've had a different one. We had Western North Carolina had a clinic, and then this. So this is growing. This is a big deal. This is what the Department of Military and Veteran Affairs thinks is the way we need to do. This is a concentrated effort to do a great job for our veterans. Coming up next, so our state veterans homes. We have a lot of construction that's coming on our homes that are existing. Fayetteville, Black Mountain. We've done a lot of construction in Kinston. We have a lot going on in Salisbury. Our homes, we're spending a lot of resource and capital on upgrading our facilities. And that's something that's going on all the time. It's always ongoing. There's a lot there. So anytime you're in, you'll see what we're doing. If you're in, you want to visit one of the homes, just stop in. The second bullet, I hear all the horns, dun, 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 all that stuff. Our newest home in Kernersville is officially ready to be opened. So Kernersville State Veteran Home, we have a grand opening. It says October 25th on here. That's not exactly right now. We're trying to work with the governor. But the bottom line is on November the 6th, we're going to start taking residents into our Kernersville facility. So we're actually going to put people in the building. This has been almost 4 years in the making. Big project, but the building's there. It's really nice. You really need to go by and see this brand new facility that does things for veterans that frankly no other veterans home, no other skilled nursing facilities in North Carolina does. This is a model for not just veterans, not just military, but for anybody that wants to put together a program to do skilled nursing. This is what they need to make their program look like. So this is here. As soon as we get the date right, we will obviously our Director of Communications will let everybody know. Veterans Day. Most of you folks get to enjoy Veterans Day by being at home and being things. I get to enjoy Veterans Day by going and participating in Veterans Day events. So I'll be in Lewisburg this weekend or that weekend speaking to the Franklin County Veterans Festival. Secretary Gaskin is going somewhere. I think Deputy Secretary Pierce is probably on the agenda. Where's Edison? He's back there somewhere. He'll be there. So we have many events across the state. Warsaw, North Carolina has the oldest Veterans Day parade in the nation. It's over 100 years old consistently now. It's a great parade. Morehead City has a great parade. Mecklenburg County has what they're doing. And I'm sure Scott and his team are right in the middle of all of that happening. So I encourage you to go spend some time at these events and see what, and just to be connected to the veteran population of North Carolina. And finally, Operation Greenlight, something that we started last year. Actually, the North Carolina Association of County Commissioners, sir, are the ones that came up with this. They went up to a national convention. They saw where other states were doing it. They brought it to North Carolina. We now have adopted Operation Greenlight as a Veterans Week event. It's very simple. Put a green light bulb in your front porch light on your house. Put a green light bulb at the entry door to your business. Just show your support of the veterans community with a green light bulb. Every one of you do something. I have 2 at my house. I put them out every year. So it's a big deal. It's getting to be a bigger deal. It's really a strong message that the state of North Carolina supports our veterans population. Takeaways, 2 or 3 things. The long session's over almost with the General Assembly, but guess what? The short session starts up in just about 3 or 4 months. So it's a never-ending cycle. We'll be doing a whole lot of work associated with the short session. I haven't said anything about the Governor's Working Group subcommittees now, but we still have, we have our 7 subcommittees that are addressing housing, education, healthcare, social enrichment, employment. They got a lot going on. They've identifying a lot of areas to put focus on and to put resources towards, things that we want to do that will make veterans things. We've talked about housing a lot. We've talked about health care a lot and how we access the mental care, the other benefits. So there's a lot going on there. Our committees are doing their thing. Finally, the connection to the Governor's Working Group. First off, great venue. And everyone online, if you're not in this room, you ought to be in this room. This is where people that really want to affect the veterans community are interacting with each other to figure out how to do that. We want this to be a preeminent event. This is a nation. This thing has been publicized nationwide. There are organizations all over the country that are sending me messages and saying, we want to see the Governor's Working Group in action. We want to see what you're doing. Can we come? Can we look at it online? What can we do? So this is a big deal. For all of you that have been doing this a long time, you know how big a deal it is. But it is a huge deal, and it's only getting better, and we're really doing a great job. And I applaud all of you for your connection to this group. And I think that's all I have, except for I'm retiring. On January 31st will be my last day of work. I have talked to Secretary Gaskin, and I'm working towards that, and I wanted to announce it during the Governor's Working Group, all you guys that I've been working with for years. I appreciate your support. I hope you think that I've been part of the solution and not part of the problem, but I've enjoyed the time with the Governor's Working Group, and I encourage all of you to continue to connect with it and to make it do better and better. So thank you very much.
Thank you so much. I know a lot of people are going to be sad to hear that, but we know you'll still be close by because he's going to be moving to Cleveland County. Next up, we have Mary Parker, Deputy Chief Medical Officer for Vision 6 VA Mid-Atlantic Healthcare Network.
Good afternoon. Thank you so much for the kind invitation to join you today. I bring greetings from Paul Cruz, the Vision 6 Network Director, and am so pleased to have the opportunity to interact with so many of you today, both here in the room and those who are joining us online after our session today. So what's going on in VA? We've only got a few things, ha ha ha. It's hard to follow the comprehensive comments of both Commissioner Dunlap and others, but the big thing that we are focusing on, particularly as it relates to Governor's Work Group, is the Compact Act rollout. And we need to spend some very important time making sure that everyone is on board so that we can be most effective and complete in our communications. We need your support and assistance as you engage with veterans every single day. So, Compact Act, can y'all still hear me in the back? There's a little bit of reverb, and I'm gonna back it up a little bit just because I don't want to be that person. The Compact Act, though, is, as it relates to this component of it, very important because it allows any veteran, whether they have engaged and enrolled in VA for eligible care services or not, to go to a VA emergency department, a non-VA emergency department at any point in time if they are in a suicidal crisis and have suicidal ideation. We are so pleased that this legislation has given us the opportunity to expand care. We certainly want to make sure that we fit that care most appropriately and most timely to the network and the area that that veteran and that veteran's loved ones are located in. I believe this slide says Wilmington up here. I think we prepped this slide coming up for this weekend's event, so sorry for the duplication there. We don't just have to send people to Wilmington to the outpatient clinic. We want them to go anywhere throughout the VISN and throughout all of those emergency departments. We want to make sure that we are, as a part of our communications, also providing reminders about 911, 988, any method through which they can have safe, warm handoffs to receive care in a super comprehensive and compassionate fashion. What will VA do? Well, once we find out about this veteran, we're going to make sure that we cover treatment and the costs of associated treatment, inpatient or outpatient, for 30 to 90 days, respectively. Again, this is an expansion of our care provision, which makes us super happy that we can extend care to those that maybe have not sought care from VA prior to today. This act allows us to provide treatment to those who are discharged or released from active duty after 24 months of active service in any situation that is defined as other than dishonorable. Those former members of armed forces, including reserve members who have more than 100 days under a combat exclusion, or those who were in some contingency operations. Those are folks that will also benefit from this expansion of care. Any member of the armed forces who had a physical or sexual assault. We have so much more work to do in this very, very important and difficult environment, and we have to do everything we can to normalize and expand care to those veterans who need it as well. And finally, as with any care, this is not just related to Compact Act. Remember, our emergency departments within VA treat humanitarian cases every single day. we follow the guidance that we turn no one away. We may have some paperwork to clean up later, and we'll deal with that. However, anyone, irrespective of whatever leads them to our facility with suicidal ideation, we will meet them and walk with them and provide that emergent and urgent care for them. So, we've talked about 911, we've talked about all the wonderful partnerships that are in this room. Thank you all for your commitment to this most wonderful population that we have the honor to serve. We want to make certain that as quickly as someone needs to access that care as able, they or their loved ones contact so that we can be notified that they are a veteran. We want people to feel comfortable disclosing that to the care team, because we have a humongous ongoing education plan and outreach that is actually also scheduled not for your day for opening the Kernersville site, which is beautiful, by the way, but a few days later we have all of North Carolina urgent care and access points that we are working to get updated, and VSOs notified of how we can streamline this for our populations just as quickly as possible. If there are bills that come in, we want to make sure that the VA patient advocate is notified, and they've got a special, I'm not going to call it an easy button. I am from the government. However, we do have special processes in place to expedite for that VA care if there is one of these situations that comes up, because again, we don't wish to add to or augment any frustration or frankly trauma associated with this really important care that we are providing. If there's compact related care at a community emergency department, we're going to work through to make sure we have a written reimbursement request that we are moving forward so that we can make sure that we have all those partnerships in place and that we can perform the care handoffs that need to happen so that we can support this very important service member and their family and their loved ones through this crisis. You've got a link. It does work. I checked it twice on VA and non-VA computers. And we want to make sure that you keep in mind that as we reach the end of October and head towards Veterans Day, you as our partners know that we will be expanding communications, and our public affairs team is working hand in hand with the emergency departments, as I indicated, both within VA and external to VA, so that we can make this care just as seamless as possible. And so with that, I am going to turn it over and say thank you again for being here and for your commitment to our most important veterans of all. Thank you.
Next up, on behalf of the Winston-Salem VA Regional Office, we have Assistant Director Creletta Robinson.
Good afternoon, everyone. I'm here on behalf of Mark Belos, our director at the Winston-Salem Regional Office. He couldn't attend today because we're having our employee celebration, and it's a big thing because the Winston-Salem Regional Office did really wonderful work last fiscal year, and we needed to celebrate our employees today. So I'm here on his behalf. I will be the one to mess this up. Go back. Okay. Okay. So just thank you. So VA benefits, the big thing for us right now is the PACT Act. I know it was a lot of confusion in August with the PACT Act. A lot of the veterans thought that they were no longer able to file their claim, and that was not the case. So we did a lot of explaining the process of what we call back pay and being able to get additional benefits for filing within a year. But since President Biden signed it into law in August 2022, we've served over 1 million claims of PACT Act claims, and 48,000 are in North Carolina. So that is an awesome statistic for the state. Hypertension and allergic rhinitis is one of the main top disabilities that are granted in North Carolina. Again, there's no deadline to file. Please get that information out because a lot of misinformation on that deadline with the PACT Act. It was only for retroactive benefits, meaning going back within a year of their file date. So with the massive increase of those claims, of course, that results in a backlog for our employees and our veterans. Right now, we're about at 303,000 backlog claims, but it will potentially grow to about 400,000 before the end of the fiscal year 2024. So what we're doing now, you might have heard us talk about it a lot, is people, process, and technology. We have a lot of hiring that's going on right now with different positions to help us with the PACT Act claims, and also to break down our backlog a little bit. Processes, we have streamlined some of our processes and procedures. When it comes to processing claims, we have the automated benefits delivery, and that's where we're using the technology piece of automation to help us process these claims faster using the automation and technology. So some highlights from just the Winston-Salem Regional Office that I want to talk about. Last fiscal year, we completed over 123,000 claims. That was a historic feat for the office. The Veteran Readiness and Education Division was awarded the Extra Large Station of the Year. And for the ones in the room and online who doesn't know what VRNE is, that is where we go out and we try to get positive outcomes with veterans who are employable still, where we send them through school, different programs, try to help them with jobs. So we do job fairs and get them ready to be in the workforce. So we were excited that we were given the award for Extra Large Station of the Year. That was really a big thing. It's in 3 categories: extra large, large, and small throughout the VA. And we at Winston-Salem received the Extra Large Station of the Year. Also, we talked about outreach VHA has, and we have done over 595 events in the North Carolina area last fiscal year. We're trying to increase that number every year because that's how you get out and you give veterans the information they need to know about filing a claim. We have a lot of veterans who are unfamiliar with the processes and procedures. So when we go out on outreach, we try not only to file claims during those outreach, but to educate not only the veterans, but their POAs or anybody that's with the veterans on the process and how to file claims. So we completed almost 600 events last year, and hopefully we'll complete a little bit more than that this year. We have an initiative at our station. I don't know if y'all been downtown Winston-Salem, but the parking can be a real nightmare. And one of the things that we looked at for our veterans, especially some with some physical disabilities where it's harder to, walk a block or 2 blocks. What we did was we worked together with the city and got free parking for those veterans. And so anytime the veterans visit our public contact area or have appointment with anybody in our office, we have a parking deck that they use, and they get free parking, and it's right next door to the regional office, so the walk isn't far for them to do. And with that, we saved about $5,000 of money for veterans, and about 673 veterans have utilized that in the last year. So hopefully we'll have more as more veterans come out and get educated in our public contact area and have more appointments. I think we all talked about the Veteran Benefit Live event in Wilmington. This is a really big event. Next year, I think I can go. I get off the new employee list. I recently just got here from Jackson, Mississippi, so I'm the newest assistant director, and I'm not on the list to go this time, but next year I think I will be a part of that. But it's a really big event, and we serve veterans and their families. Last year, I can remember just hearing the statistics of the amount of veterans that attended the event and was able to get their claims processed right there on the spot. We also have the Veteran Readiness and Employee group there, and they help with resumes and enrolling veterans in their program as well. We have the life insurance, healthcare benefits, the cemetery, homeless, low-income housing with support there, and also different vendors in different areas for the community partners. So Mr. Westbrook, yeah, that's what it was. He talked about the event being a very big event, and the regional office enjoy going out and doing those events. We've done about 5 Veteran Benefits Live, and we are lining up our events and our outreaches for this fiscal year as well. So hopefully we'll come to a town or city near you with the Veteran Benefits Live. It's really beneficial to the veterans. Takeaways. Of course, I can't leave without saying PACT Act. Please get your veterans to apply for those benefits. They're out there for them, and it's really good to get them information. So please go to the va.gov website, and it has a whole section on PACT Act. Again, the Veterans Benefit Live event in Wilmington from October 19th through the 21st. And for those of you who are wondering about the continuing resolution, that does not affect any veteran benefits. So if the government was to shut down, veteran benefits would not be impacted. One of the things that we like to do before we sit down is always give a good news story about anything that happened during one of our outreach events that we feel like should be shared, because it's one of those things we want to celebrate the veterans and the help that we're giving when we go out to this outreach. So in our Veteran Benefits Live event in High Point, we met a Vietnam veteran who was drafted in 1969. And this veteran had never filed for any benefits. In fact, he was just there because they said it was a veterans event. We were able to process his claim right there in July, and within 2 hours, he had a completed rating decision, and he was granted 100% right there during that event. So that just shows you the benefits of having your veterans, having those populations come out and just kind of talk to us, because a lot of times, like I said, it's the education piece of not knowing how to file or not knowing the benefits that's available to them that helps us. So, and that is all I have. So thank you, guys.
right, next up we have Renee Rader with DHHS, and I'm going to ask that we go quickly because we do want to get to the panel. Welcome and thank you for coming.
Hi, everyone. It's always great to be here. I am going to be super quick. We've got lots of exciting news at the Department of Health and Human Services this month, but I can talk about that quickly. So first of all, Medicaid expansion has been written into law. We are prepared to launch that on December 1st, 2023, which will increase access for health care to more than 600,000 North Carolinians. We estimate that approximately 14,000 North Carolina veterans will gain health coverage through Medicaid expansion. Just a little fact up here that the rate of uninsured veterans decreases on average by 4.3% in Medicaid expansion states. I have some details on here about what Medicaid expansion will cover. So basically, you can earn a higher income. People who currently are only receiving family planning benefits will have access to the full Medicaid package. And we have lots and lots of good information on our website, including a toolkit that helps people know how to sign up for benefits. And that information is available in both English and Spanish. State budget update. We did really well this year in the behavioral health system with the state budget. We had over $835 million investment in behavioral health. A good portion of that, about $750,000, are part of the Medicaid sign-on bonus that we got for expanding Medicaid. But some of the things that this will include is rate increases for our providers of behavioral health services, so we can get better providers, more providers, increase accessibility across the state. We are going to have investments in our crisis system, investments in our justice system, and additionally, we are expanding our NC Innovations waiver slots up by 350 people, and that's the program that serves people with intellectual and developmental disabilities. And I'm going to just zip on by. Finally, three last things, super quick. We are expanding 988 here in North Carolina with the addition of a peer warm line, so folks can call 24/7 and have access to somebody who has lived experience with either a mental illness or substance use disorder. This is not a crisis line, but this is a line that folks can call for someone to talk to. In the next couple of weeks here, we're going to announce that number. We actually managed to get a very clever number that's going to be easy to remember. It won't be as easy as 988, but it will be easy for everyone, and it will be linked to our 988 program so that if someone does call that number and they're in crisis, they can get access to the services and referrals that they need. I also wanted to draw your attention, if you're interested in behavioral health, we have a new side-by-side webinar that is a monthly webinar where we're inviting all members of our community, all stakeholders, to come and learn more about what's happening with behavioral health care in North Carolina. You can certainly feel free to reach out to me, and I can get you connected with that information and have you put on our mailing list. And then finally, if I haven't mentioned it before, the DHHS agency bill has officially changed our name to the Division of Mental Health, Developmental Disabilities, and Substance Use Services. That was about 10 years in the making, and so we're so pleased to have that done. Thank you, everybody.
Next up, we have Gabriela Gonzalez, Director of Veteran Employment Services with the NC Works.
I like this place. Can we have it again here next time? Okay, so I just wanted to let you know that working in silos has come to a stop. We're all collaborating, working together. That is the best way to assist a veteran when they seek services. I just wanted to throw that out there. Veterans Treatment Court. So Caldwell and Burke counties have been added to Catawba County. So now we have Catawba, Caldwell, and Burke counties amongst the others that are currently ongoing. Plus Moore County will be added in springtime. The task force has already been created. So that is a lot of veteran treatment courts. So we're heavily involved in those veteran treatment courts. And they're still growing. So we're very excited to assist them. And let me give you in a nutshell what we're doing. So we're NCWorks Career Veteran Services. We are veteran representatives that mitigate barriers to employment for veterans, military service transitioning members, and military spouses, assist them in employment services, and then connect them to resources and assist them in employment. Now, upcoming events for our Employer Veterans Week. We have some events coming up. Keep those in mind. We should have them on LinkedIn. November 6th is Think a Vet weekend or event. Then November 8th in Jacksonville, American Legion. Then one in New Bern. November 8th also Pitt County NCWorks. Pasquotank NCWorks. And then Think a Vet event in Jackson County in the NCWorks. And then November 9th at the Eastern Band of the Cherokee, Steve Young Deer, American Legion. And there are more events coming up. And then update on Hilton Honors. Again, Hilton Honors, where the referrals are increasing. And so far we have 120 referrals, 170 total of inquiries, and they're still increasing. And mostly they are for housing, followed by training, followed by job interviews. Now, actually, the military branch is finally tied Air Force and Marine Corps, followed by the Army. So Army is no more leading. Then I wanted to share something. I've participated in a webinar on the naturalization process for military service members and their families. This is something that not many think about. But we have military service members that are not Americans that are in the service. So this is very important. If you do have veterans that are actually coming out and they're not naturalized, think about this to connect them to those resources. And that was very important that they can and are eligible to be naturalized. So that is something to think about. Not many are. And that concludes my spiel. Thank you.
All right. Thank you all for that, all those wonderful presentations. And you can get these slides if there's something that you missed. They will be at ncgwg.org under meetings. They should be uploaded in just a few days, and you can download the entire presentation. So I'll ask the expert panel to please come up front and join me. Today's expert panel, Shaping the Battlefield, Awareness and Training to Improve Outcome for Vets, has some of my very favorite people on it. Content warning. Some of the topics to be discussed may include suicide, self-injurious behavior, substance abuse, depression, post-traumatic stress, and or other mental health disorders which can act as triggers. Please feel free to excuse should you feel uncomfortable. A qualified team member is available just outside the room to assist you. All right. I would like to introduce our panel, and our moderator today is Blake Bourne, Director of Veterans Bridge Home. We have as a panelist Dr. Justin Johnson with Hopeway Veterans Program, Dr. Nicole French with Veterans Bridge Home. We have Jennifer Melton, Veteran Services of the Carolinas, and we have Travis Haymore, Air Force veteran and peer. Thank you all for being here. Turning it over to you, Blake.
Thanks, Crystal. You guys hear me okay? Awesome. Is yours on? Hello? Nope, not yet. Okay. Good afternoon. It's great to see everyone. Thank you for being here. Thanks for this opportunity. Just one note, I'm not an expert. These guys are. I'm just the moderator. So when it comes to an expert panel, just look to my left, you're right. As Crystal mentioned, I'm the Executive Director of Veterans Bridge Home, Army veteran. I want to give these guys, you heard a little bit about them. You know, for time's sake, why don't we promise to stick around afterwards in the reception, talk a little bit more. We'll save a few minutes and hopefully get caught up. But when you look at the title of the panel, I think it's important, right? Sometimes the military terms can be overused in our space, right? I'm the biggest culprit of that at times, using terms that were, you know, normal in the infantry, but maybe not in the community. But the truth is, what's that? Oh, gotcha. The truth is, it is still a battlefield. Just on Monday, this week, we had a good news, bad news story. The good news is a gentleman, a veteran living here in Mecklenburg County, called 988. 988 was there. They answered the call. They addressed the need. They called CMPD. CMPD reacted, got mobile crisis on site, and then transferred them to the nearest healthcare, similar to the Compact Act that was shared earlier, an atrium site, and got him the care that he needed. Then Mobile Crisis shared that information with our organization, VBH, who then took that over to the VHA patient transfer team. That all happened within a few hours of that veteran in crisis. That's huge. That wouldn't have happened years ago. So to have that alignment, it's a great story. What I see, though, is a veteran in need who didn't have anyone else to reach out to. I'm glad 988 was there. I'm glad everyone responded in the way they should. But I'm concerned that he did not have someone a caring contact. He didn't have someone to coach him into care. He didn't have someone, as you'll hear from our panelists, who knew what to do in that moment, whether he felt comfortable or not, whether his friends and family and colleagues were ready or not. That's a bigger challenge. So that's what our panel is about. That's why it is a battlefield. We can do better. So I'm going to turn it over to our panelists. I'm going to have a few questions. We have questions for time at the end, so Simran is going to help with a microphone. So we'll try to preserve some time for that. But I want to get started with my good friend Travis Haymore, Air Force veteran, who not only served himself and has been an amazing advocate and friend in the veteran space, but to me leads by example of being that caring contact and that expert companion. So Travis, if you don't mind kicking us off, you've experienced veterans in crisis on a personal and professional level, and you've answered the call. You've taken part in training yourself to prepare yourself for those situations. So talk to us, if you don't mind, share a little bit about those experiences and why this is so important.
Absolutely. Good day, everybody. First off, let me thank the Bridge Home for being there, because I've gotten training through them that have helped enable me to talk the talk, so to speak. I wish I could go through a lot of the scenarios that I've had unfold in front of me over the past several years. The story that Blake just talked about is remarkable. And like you said, this wouldn't have happened 10 years ago. But there are a lot of facts that have unfolded, especially post-Vietnam. We now understand post-traumatic stress a lot better. We understand TBI a lot better, and we're able to respond to that stuff. I have two Marines, and both of my Marines have been at risk because of their service. One of them, my son, I wasn't aware, and thanks to the Cabarrus County Veteran Service Officer, Tony Miller, Doc French here in Blake, I still have my son. So that's a fact, and that unfolded before my eyes. And being in the field, didn't know my son was at risk. So pay attention at home, because you might. I would hope that you wouldn't see what I failed to see. Given that, these things can present themselves to you in a multitude of ways. I'm a nerd by trade. I'm a computer guy, so I have presence on social media. I get calls on social media. I get messages on social media because I'm a member of different veteran forums and things like that. I have been engaged by veterans where I get up in the middle of the night, ask the questions that I'm trained to ask, and when I see the flag, I take action. You know, whether I reach out and call somebody, I have had situations where I have gone to sit with them and talk. I have actually gotten them into my car and gotten them to a facility to get them checked in. There's a multitude of ways you can make that difference, and the number one is you just have to care. My service, I wasn't really in the military. I was in the Air Force, so we had issues in the Air Force. Everybody has issues. I just wish I was trained to see it, because I spent a lot of time as a police officer, and I didn't have the training then to be able to address stuff. I just thought, this guy's, talking about suicide. I don't know what to do. Now I do, because of the bridge home. Doc French and Blake have got me training to where I can see and recognize some of the signs, some of the flags, so you can make that difference. Whether it be at home, whether it be veterans that you just come in contact with. I'm real active in the motorcycle community here. I ride a motorcycle year long. Had an Army vet. I learn the vets either where I work or the groups I ride with or friends. I learn who's who, because you guys know, the vets, we razz each other. That's the way we are. So I happened to see one of these guys one night in the sports bar right there by the Harley shop, and something just wasn't right. So I left my group and I went over and sat down and talked to him, and he was going through some rough stuff, and I asked some questions because I was trained to ask these questions and determine that he was at risk. And we still have him today because these questions were asked, and we got him the help he needed, and he is now in a much better place. So the training is a big deal. The questions to ask are a big deal. The questions not to ask are probably as big of a deal. So reach out, get the training. You can make that difference. You can keep that troop around.
Thanks, Travis. So I didn't want to steal too much of Travis's thunder, but I think it's important that we all understand there are so many resources out there. And no matter what your branch of service, no matter when you served, what you're doing currently, as Travis just described, it could come up in any number of places. In the home, out in the community, at work. Travis is pretty humble. He's done some amazing things with other folks that, for their privacy, have decided not to bring up in this case. Being there when they need something, noticing it, and being confident to step into those conversations and those questions can literally save a life, and Travis has done that on numerous occasions. But why we wanted Travis to be a part of this is because he also is easy to admit that it's not that easy. It takes some work. It takes some training. So before I jump to Dr. Johnson, I do want to mention on the agenda, on the back side of the agenda, you should have the training intervention reference guide. My eyes say there's about 30 different trainings there. It includes mental health first aid, SAVE training, assist training, 15 things veterans want you to know, QPR, VSS. These are some amazing resources. If you're not familiar with what those are, and they just sound like acronyms, I implore you to look at that, because those are the types of resources that allowed Travis to be more equipped in those moments. So that's what happens out in the community. Let's shift to Dr. Johnson. You've worked inside of the VA, Army veteran yourself, private and in the VA with inpatient, outpatient, a lot of different care. Talk to me about when you see folks in crisis and you're supporting them as patients, as a psychiatrist, the difference between those that have someone like Travis in their life and then maybe those that don't, and why it's important.
Yeah, absolutely. Great question. Thank you all for having me. So as Blake was saying, I'm a psychiatrist. I currently work at Hopeway in Charlotte, where I work in a residential unit, which is one step below inpatient. And before that, I worked at the Durham VA, where I was a psychiatrist on their inpatient unit and in their emergency room. I've spent years working in acute settings, so hospital locked type of settings, and so veterans who are in the highest level of crisis. And I absolutely think trainings like this are important because first of all, you don't have to be an expert to help people. So much of what I see from veterans in crisis are things like homelessness, job insecurity, psychosocial stressors, the social determinants of health, which I know VBH and other people really work hard on. In fact, that's sort of frustrating as a psychiatrist because you see people in the emergency room and you're like, I'm not really equipped to help you with your homelessness. That's not a medical issue, but it ends up presenting in a medical setting. And so I think it's invaluable to have community members like this group and others who are dedicated to helping veterans to really target downstream social determinants of help. If we had more of that, I think, I don't know the percentage, but enormous percentage of people wouldn't make it all the way up to the acute level of crisis. So I can't underscore enough. I think trainings like this are hugely important.
So, Dr. Johnson, we didn't necessarily cover this, so I'm going to put you on the spot. But when you were at the Durham VA and now at Hopeway, do you have unlimited beds?
No.
Do you have limited clinicians?
Oh, no.
And do you have unlimited time to address every need for every veteran at every moment?
No.
Okay. So just to be clear, we can't solve the problem by waiting for veterans to end up in a residential, inpatient, or even outpatient behavioral health situation, right?
That's correct.
Okay. Thank God you are there in any one of those settings. We've got great professionals in all those areas. But if we don't get upstream, if I heard you correctly, then there will be backlogs. There will be challenges, right? There's only so much that you can do.
Yes, absolutely.
Okay. Just want to make sure, confirm for the infantry types in the room. And you talked about social determinants of health. I think that's really important because there's a lot of crossover, right? And Gabby, you mentioned no silos. I think it's important that we understand how we work, across those. And in the positions you've been in, you've had a chance to help connect into and through the community. I want to toss it to Dr. French here in a minute, but talk to me a little bit about just, Dr. Johnson, what you've seen over the last few years from when you were in the VA to where you are now, what those handoffs look like and what's made them effective.
Yeah, I think, well, first of all, as a psychiatrist, really in both the VA and even at Hopeway, I spend much of my time taking care of patients, so seeing patients every day. So I myself am still learning the enormous network of community organizations across North Carolina. And I think coming to events like this and the summit that VBH and Salisbury VA had last week are incredibly important at connecting people, including people like me who, I think of myself as an expert in veterans' mental health, but I don't know all the organizations in North Carolina, so I think continuing to do things like this is helpful. Otherwise, pass off, I think, platforms like NC Serves are hugely important, and I think are a big advance over trying to call people and track people down. Yeah, I think
that's perfect. Yeah, and I think Dr. Vera is here from the whole health department at the Salisbury VA. It's that frame of looking at the veteran, allowing the veteran to see ourselves in that whole health frame implies that we need to work together, right?
Yes.
And make sure that we have those relationships so that those handoffs can be made. It's another form of coaching into care, different than the peer support and the training in the community, but I think it's again, it's about relationships. So thank you for that. Dr. French, Nicole, my teammate at VBH, also an Army veteran, for those keeping score at home. As a psychologist, you've spent most of your career at this point, whether it was active duty, reserves, and now also in the nonprofit space, of sort of bridging, the community and providers similar to Dr. Johnson. Can you talk to me a little bit about that, and then also the differences that you can see when folks have someone like Travis in their life to make those caring contacts?
Sure. Yes, the bridge is really important, and but as a clinician, having a family member, having a friend, having a first responder out in the community who actually understands how the system works as well, because our system is pretty fragmented. So being able to, for example, when this CMPD officer called on Monday saying, hey, what do I do? This is the first time. And that's to be expected when it's the first time, right? But when he automatically became the client patient's advocate, right? Because he was a veteran himself, I learned, actually. So it's like all of a sudden somebody asks for help, all of a sudden you're on the scene. It is really important to be armed with that knowledge, but also the care and the compassion to help direct somebody who's anxious and distressed. Like, this veteran asked for help. This veteran wanted to get to the VA. The VA is 45 minutes away. The only solution was really getting an ambulance and getting him to the nearest emergency room, which is the right call. And he identified himself. And the VA was able to say, hey, let's work together to identify options of care, right, with this emergency room. So it matters. I think of a spouse I talked to in December. She said, I'm worried about my spouse. I want to know options. We talked about petitioning the magistrate, which you can do in this county, and getting an involuntary commitment to get a veteran who doesn't have insight into their problem to care. Well, she called again this last week, and we walked her through the process. It was much faster this time. The veteran actually did get into care, and the veteran's doing great with some medication, with just a little bit of stabilization, and he should be able to return to his job, full-time job, a very good job, next week. So those are just examples of the bridges that family members make, first responders.
And so, Ben, back to Travis as the example, it could be a family member, it could be a community member, it could be a spouse. We don't know. So that's why it's important to equip all of us and to understand the difference, right? What Dr. Johnson represents, right, as a psychiatrist that does residential program currently but has been focused in the acute space, or Dr. French as a psychologist. These are layers, right? Or back to the military terms, right? Echelons of fire, right? The more intense the weapon system, right, the bigger the problem potentially. So how do we prevent those problems from happening? I think, Dr. Nicole, you've done a great job of connecting that clinical space, and for folks like that, whether it's a CMPD officer or a spouse, but same question as Dr. Johnson, do you have unlimited time and resources? No. Are there unlimited psychologists to bridge that gap between clinical and community-based care?
No.
So then please pass the microphone to your left, because the next echelon is care coordination, right? Who can make those contacts? Who can work with Gabby and her team at NC Works or VBA at a VAC or Whole Health and make sure that the connections are being made and the support and the training is there so that we can, again, open up our aperture, reach more people. I think it comes from VSC. And Jennifer, I'm going to put you on the spot in two fronts. One is VSC, you guys do some great work in care coordination, and then of course the supporting services for homeless veterans, HVRP. But talk to us a little bit more about your specific role with the suicide prevention grant, the Staff Sergeant Fox grant, and what you take on and why it's important and how you engage the community.
Absolutely. Thanks for having me, everybody. So I work as an education specialist under the Staff Sergeant Fox Suicide Prevention Grant. And really what that allows me to do is teach QPR, suicide prevention, mental health first aid. Just became certified in RAP, and we're working on some other things. But what this allows us to do is train as many community members and community stakeholders that will basically listen to look out for signs, those early signs and symptoms, so that we can start to work on preventing people from getting to the crisis stage where I then have to refer them over to Dr. Johnson or Dr. French, right? Because I think you said it earlier, and Travis, you as well, that we don't have to, regular everyday people can do this, right? I don't have to have a bunch of letters next to my name, because I don't. So I don't diagnose or treat anybody, but I can serve as the link to someone who is suffering with a mental health challenge, and then connecting them to that appropriate professional help, such as the doctors that sit up here today, to make sure they are getting that help. We can also then work to connect them with other programs, because part of the Staff Sergeant Fox grant is we are lucky enough that we can have peer supports and case management for people who are suffering, veterans who are suffering with suicidal ideations, and walk alongside them to make sure that not only they get connected to the care, but that we're also addressing all of those other needs that are associated with that.
So for those that aren't familiar with the Staff Sergeant Fox grant, it's an amazing program that was launched, passed in 2020, launched last year. There's two organizations in North Carolina, Veterans Service of the Carolinas is one, Veterans Bridge Home is another. But what it does is expands that net, right? If you think about a funnel, right, or a net, the narrow end is here with the clinicians, right, and the amazing resources we have, like the VA, like Hopeway, and then opens that up to try to reach more veterans, provide more of that community education training. So you mentioned some great trainings on this list. Nicole, you used the term expert companion a lot. You mentioned, Jennifer, walking alongside someone. So talk to me a little bit about let me back up. Jennifer, I saw someone recently, I think Tim shared with me, how many folks have you trained recently?
Oh, so as of yesterday, since the beginning of our grant work last October, so just in a year's time, we've trained just under 1,200 people.
Say that again for everybody that didn't hear.
1,200 people.
1,200 folks. And you personally have done most of that training.
I have been attached to probably 1,000 of those.
Okay.
Yeah.
So, but just to double check, Mr. Westbrook, how many veterans are in North Carolina? 700,000, right. But we just got 1,200 new folks that much closer to those 700,000 with those resources like the training that Travis has mentioned.
Yeah, absolutely. And we're working alongside, there's people in this room, we're working with Edison and Steve to get a lot of the veteran service officers, because that's a front line for us. That's, I know, for you guys as well. That's some of the first people we connect with when we find a veteran. But just also getting the people in the communities who are just regular everyday people to look for some of those signs, because even though I might know the signs and everyone up here might know the signs, we might not see the signs, right? It might be somebody in our community who maybe doesn't spend a lot of time with that person, but they can recognize those early signs and symptoms and then work on having those tough conversations and getting towards that question of, are you thinking of taking your life? Are you thinking of killing yourself, right?
Right, right. Yeah. But it's being there potentially even before that moment, right?
Yes.
Like you said, upstream and
Absolutely.
Yeah. And that can happen. I mean, we had Lowe's, it was here, right? Great employer based in Mooresville, North Carolina. And you know, where you work, who you're around, where you spend your most time, those things matter, right? We need to equip folks. So, Dr. French, I skipped over you, but in this question, but from an expert companion, I've used that term. You've indoctrinated me with that term. Jennifer, do you have a preferred term when we think about, like, you know, coaching in a care or expert companion? If so, what is it, and what does it mean to the layman in the room?
Wow, I don't know. I do love that term though, so I might have to steal it. I think just having that peer level, right, peer support. So I am a certified peer support specialist in the state. I struggled with my own suicidal ideations in 2017. So I think really having, and I love that we're utilizing peer supports more, because they can have a really big impact on people, right? But we do have to still work to find those professional companions as well.
Right, and that's where peer support gets, I think, used a lot, but as Jennifer just mentioned, peer support specialist, she's certified in that. So while you said you don't have letters behind your name, that's kind of some letters behind your name. So I think, so if folks wanted to learn more about that certification or some of the trainings you mentioned or those that are on the agenda, what would you say from, how do they find out about it? How can they get signed up?
Well, for a lot of those, you could reach out to me. I'm happy to make connections for you. Veterans Bridge Home also has a lot of those great connections. But a lot of these you can find online, right? The Governor's Institute's great if you're looking for any mental health first aid classes. You can sign up actually right on the website. It's fantastic. And those are offered by a variety of providers throughout the state and across the state, right? One of the great things about the suicide prevention grant is that it touches all 100 counties, so we're not limited in space there. As far as QPRs, VSS is coming up in May, so Dave Roddenberry, get with him if you feel like you want to take that. But a lot of these are easily accessible, and I'm happy to, if you want to catch me afterwards, I can give you my card. I'm happy to help make those connections so that we can get more people trained in those modalities.
Absolutely. Nicole, do you want to add anything to Jennifer's?
Chime in. So we are co-facilitating Assist in December. Stop Soldier Suicide has a grant. So
what is Assist?
Assist. It's a 2-day suicide prevention training. I see others in the room with experience setting up that training, but you can go to Veterans Bridge Home's website right now on the calendar and register. And then my battle buddy over here, it's probably another term I would use, but the Governor's Challenge. North Carolina has really led the way with Mecklenburg County in terms of training peers and training providers. So please sign up for the Governor's Challenge. Go to Psych Armor, psycharmor.org. It will actually, there'll be a pop-up that says, do you want to join your Governor's Challenge? Click North Carolina, because we want to lead the way. across the nation. Register, and many of those trainings that Blake listed, like 15 things every veteran needs to know, or every veteran wants you to know, is on there. It's literally less than 15 minutes, and it's a great introduction to grow military culture in your organization.
Perfect. Thank you very much, Nicole. All right, so great ways to sign up, two great organizations. Travis, I'm going to come back to you, but Simran, if we have an extra microphone, I'd love to see if there's any questions here or in the chat. I believe there's a chat function through Facebook. Secretary Westbrook, first up.
Thanks. I'm going to stand up just because I like to be seen. A couple of things from what there. Number one, I really want to reinforce Veteran Support Specialist training. VSS training is something that's been around North Carolina forever. This is a program that is exactly about training folks like me to be able to deal with these issues that our expert panel's at. The Governor's Institute has now adopted that program, and they're the ones that are kind of overseeing the training happen. But this is something every person in this room could go to. And you could go, and Dave's crowd, they have classes all over the state. You can learn the basics of what these guys are talking about right there at this event. We could take the state of North Carolina, we could take DHHS and put 100 people in a classroom and deal with this there. This is a great thing. The other thing I want to say in support of our folks, and Blake made mention a couple times, do you have unlimited resources? Do you have unlimited this or that? John, they may not have them, but we've got folks all over North Carolina that are resources. The Cohen Clinics, Joel Fund. That's just two right off the bat that are sticking out. We've got folks like Patrick Davis at the Hero Center. We've got different organizations all over the state that they have, people in there that are professionals that are involved in the mental health issues that veterans have all over the state. So don't think that if you're in Rockingham, North Carolina, that the VA hospital is the place you got to go to. Or if you're in Jacksonville, you need to go to the Cohen Clinic. Or if you're in Fayetteville or something like that, there are resources. And the Department of Military and Veteran Affairs, shameless plug, our resource guide has a lot of information when we get it published out there that we keep updating. We've got a way for you to be able to know where to refer somebody to get the kind of help they need. So please don't miss the fact that we're developing resources. So at the same time, any of you that wants to get your team on our team involved with them, we want to expand our network. So this net is just, we don't want that funnel to be little. We want that funnel to be huge. We want to make sure we have everybody that we can get in place from everywhere. There's a gentleman, Dr. John Wheeler, right? There's a guy here, expert in Charlotte, mental health stuff. He does a lot of evaluations. There are all kinds of doctors, there's all kinds of clinicians all over North Carolina that all we have to do is let them know we're trying to do this, and they want to join our network and be part of what we're doing. So,
thank you for that reminder, sir. What other questions do you have? We got caught up, by the way, so we're still 4.5 minutes ahead of time schedule. Anything else? Has anyone else in the audience taken part in mental health first aid or assist or QPR that wouldn't, now that I got you to raise your hand, wouldn't mind mentioning what it meant to you and what the experience was like now that you've been through that training? Now I've got 3 of you in my sights.
It was eye-opening. It was eye-opening. I have my own mental health problems, runs in the family, but to hear other people's stories and to know how to approach, because just how I approach, I would want someone to approach me isn't necessarily the same way everybody wants to be approached. So that was eye-opening to know that, and like I said, rewarding.
Thank you for sharing that. Yeah, it's I think something as a veteran you can sometimes take for granted. Oh, we can handle anything, right? Whether it's personally or whether it's with a friend or family one or loved one. So, but if we also learned anything in the military is there's never enough training, right? you can always train more. So, Chris, I saw you raise your hand too. Team Red, White, and Blue, Chris Sloan. Anything you want to share from some of the training, which training you took and what it meant for you?
So I was able to go through the ASSIST program back in August in Hope County. So I was a pre-hospital health provider before I joined the military. Spent 26 years now in the Army. And so, I've seen it from both sides, where as a healthcare provider, I don't feel that I was adequately prepared for what I learned in the training. Because we show up in a flashing red and white box, and we take you to the hospital. What I didn't know was about seeing the signs and not being afraid to ask the questions, and that was a very important part of the training and getting those folks through the process of getting help after you ask the right questions.
Yeah. Thank you, Chris, for that very much. All right, so I want to give our panelists a chance to share any last thoughts, and then I'll try to wrap this up and get us back on schedule for Crystal. But starting with you, Dr. Johnson, anything you wanted to share before we wrap up for the audience?
No, I think it's the point about the expert companion is huge. If people, I teach some courses for patients, and they're always asking me, "What can I do? What am I supposed to say?" And when someone comes to me in crisis, and just it's really important that you don't have to be an expert. It's really all it takes is being a good person. So listening and caring, and then being aware and knowledgeable through trainings like this to get people in the right direction.
Thank you, Nicole.
And thank you. The expert part, just the reminder of it is all of us, takes all of us. And I think that comes from the post-traumatic growth literature, and it really is designed to think about, back to even person-centered care, how do we become an expert on ourselves? And I just really appreciate the courage to say, hey, this is the way I'd like to be communicated with during a time of crisis, for example. That is really courageous and honest, and I think that is what this work is about, is honoring human experience. And so I wrote just a couple things because I just really appreciate the confident vulnerability kind of just in this room. And I think training allows us to really get practice. Go and raise your hand and say, I want to engage. You can sign up for training. And then go out and engage. Show up to events like this. And then, training helps us honor our own fear. When somebody says, I'm thinking about suicide, if you haven't been in that place before, of course you're nervous, but training helps you understand that that's a really good thing, right? That person has reasons for living, and continue that conversation, know where to refer. And then nourish yourself, because that is actually really important as we do this work. It takes all of us. We have to be healthy, and actually the way we combat stigma is saying we're human too, and we need supports, and we're willing to engage in them.
Thank you, Nicole. Jennifer?
Just to piggyback a little bit off of that, I think it can be really intimidating when we're faced with somebody who's having a mental health challenge, right? Because first, we're not trained in that. That's not something we learn in school. What are you supposed to do? What do you say? How do you connect them to people? That's why these trainings are really important. If you think about CPR, and I'm going to date myself a little bit, but when I was a teenager, 20 plus years ago, not a lot of people were trained in CPR, and a lot of people died unnecessarily because we didn't have soft skills, right? It works the same with mental health. If we get these trainings, right, and get a lot of our community partners and community members trained in this, we can save lives just like CPR saves lives, right? We don't have to lose lives unnecessarily. We just need the soft skills and know what to look for and who to connect them to. So I would encourage you to get those trainings as much as you can, because to Dr. French's point, it takes practice, right? They're not easy conversations always, but with that practice and with that extra training, you're going to gain that experience, and then feel more comfortable asking those questions. And then also just remember, it's not how you ask those questions, it's that you have the conversations, right? You have to ask the question. That's how we save lives.
Absolutely. And Travis, before I give you the final word, one thing I want to point out, Dr. Johnson stole a little bit of my thunder about being a good person, right? That does matter. I absolutely 110% agree, but I just want to juxtapose the attempt at being a good person versus being a trained and equipped person. One of my first months here in Charlotte, I joined Team Red, White, and Blue. I went on a run on the Greenway shortly after I met Dr. French at Veterans Bridge Home, and similar to Travis, I was on unexpectedly met a female Marine who all of a sudden was in crisis. That was the moment that she felt comfortable enough to share with someone who we didn't know each other very well, that she was in crisis. I had never been to mental health first aid. I had never been to assist. I had never been to QPR. I didn't really know what to do. I tried to be a good person, and the best I could think of was, U-turn, right? Wagon wheel, turn it around, run back to the Veterans Bridge Home parking lot, and knock on Nicole French's door. It's like her second day on the job. And that was the best I could figure in that moment. I was glad to be there with Team Red, White, and Blue. I was glad that that female Marine had that, comfort level to share. And she's been doing great ever since. So it can come down to being a good person. But I would say be less like Blake and just a good person, and be more like Travis, a good person who's equipped and trained, right? Just Dave Roddenberry mentioned this on one of our prep calls. It's sort of like combat lifesaver, right? And having a tourniquet. That makes it, you can't put a trauma surgeon everywhere, but you can arm everyone with a tourniquet, and you can teach them how to use that combat lifesaver skills. That's what will save someone's life more than just wanting to. So that's why I'm going to pass it to Travis. From your perspective, for anyone that wants to be a good person, and that it has to start there, you have to care, but might be nervous, or we've talked a lot about soft skills and the caring. I met you on a motorcycle with a leather vest, not necessarily what you think of when you think of carrying contact. Travis, what advice would you give to your fellow veterans and to the community members and providers on why these trainings are important and they should engage in the way that you have?
Wow, I could probably spend all day on that. First off, let me acknowledge there's been a couple here today that have self-confessed about being at risk. It takes a lot of courage to do. One of the things that I talk about when I talk to people is it's okay to not be okay, but it's not okay to clock out early. And that's what we need to get the training for. The training has enabled me to recognize the signs, the words, the actions that I wouldn't have recognized or observed otherwise. And that has helped enable me and teams like the Bridge Home and some of the VSOs that I work with to be able to keep people around that otherwise may not be. So I got the initial training for QPR, the question, persuade, and refer training through the Bridge Home. And I don't know if you guys know it or not, but I actually went and got certified as an instructor because I go around to the bike clubs, the hog groups, and the other veteran services organizations and train them. Because the more warriors we have out here on this front that we're all on, the bigger impact we can have at keeping these youngsters around to keep them from clocking out early. So Nicole sent me last week a new invite for some more training that I will be at. So anytime you can get training like that, take advantage of it. And I want to put it out there to you guys. If you need assistant instructors to help you, give me a call and I'll be there.
So be more like Travis, get trained with Jennifer and Nicole, and help Dr. Johnson prevent suicide. Please let's hear it for our panelists. Crystal, back to you. Oh, there's an example. Go ahead. Oh, and then that's right. Brad Wren from the UNC system was supposed to join us. We're going to talk a little bit about some culturally competent training, aka green zone training, which is great for higher ed institutions. So that's also on the list. He unfortunately couldn't join us, but sends his regards and has done a great job at UNCG and then now at the UNC system. Travis?
This is an example of what's out there. Ladies and gentlemen, this is a thing. You probably can't read that, but this is a young man up in Hickory, I believe, that put on Facebook what his intent was. The numbers to call, the people to call. In there, he said, call my dad because he doesn't respond to texts either call or text. He's specific about what he wants done. He lays out the method where he's going to do it. He talks about not being in his apartment. He doesn't want to get it messed up. He says that the door's open. Next slide. It's a thing. I just wish I'd have known an hour ahead of time because I was about an hour away from him, and I would have gotten out there to talk to him. This is one of many examples that I have where we failed him. And now he's got a widow and a daughter out there that are surviving. So this is what we want to prevent. It's tough. This is a punch in the teeth, but this is what we face. This is what we deal with, and this is why we're here, is to do our best to keep this from happening. So get some training.
I just comment really quickly. Thank you, Travis, for bringing this example. And this is definitely, I mean, we were all involved in kind of the postvention efforts. Postvention is, you can get training in postvention. Psych Armor offers it. The VA Suicide Prevention Team offers suicide postvention. What does that mean? It means support for suicide loss survivors. Suicide impacts all of us. And in this case, especially if we're a loss survivor, and we know somebody very closely, just even seeing this on Facebook impacts us. It's devastating, and it hurts. And so UNC actually used their counseling department to bring those impacted together. That's part of postvention. Let's talk about it. Let's learn more about suicide, but actually taking care of the suicide loss survivors is suicide prevention itself, and it's really important. And we don't know how to do that very well. And so that's just another thing that we get to just learn more about and practice.
Thank you for that reminder. Thank you for the opportunity. Dave?
Oh, yes. So this is one of my favorite quotes, and we will back to veterans love to offer help. It's just harder to ask for help. And this quote reminds me of just the importance of, or what help even means. So David White says, to ask for visible and invisible help, and to ask for the right kind of help, and to ask it in a way in which we feel that it is no less than our due, that in effect we deserve a visible and invisible helping hand, may be an engine of transformation itself. I invite all of us to ask for help and enter into that transformative process of just doing that.
Ask for help and be the help. Let's hear it for our panelists.
Thank all of you so much. And you can access those trainings at the ncgwg.org website as well, under the Governor's Challenge and under resources. Actually, Psych Armor has its own little tab, I think. Dave, we still have the Psych Armor tab under the Governor's Working Group? Yes, so NCGWG, click on the Governor's Challenge, and you can get access to all those classes. All right, next up, we have one of our Community Veterans Engagement Board representatives here to give us some updates for the statewide and Blue Ridge Veterans Community Veterans Engagement Board. Phil Tarango, co-chairman of Eastern Carolinas Coalition. Welcome, Phil.
First off, a pleasure to be here. And secondly, Eastern Carolina, if you think about starting in Goldsboro, working your way north to Rocky Mount, and just stay on 95 till you hit the Virginia border, that starts defining our area. The other part, go back to Goldsboro, head to Kinston, New Bern, to the coast, and that entire block of about 17 counties is what we encompass. Very large, very challenging, and very rural. Like a lot of other CVABs, we've gone in for a Woodruff Foundation grant, and we went one too far. And that grant request was tied to reducing stressors that cause suicide, be it food insufficiency, homelessness, even something childcare, because one of the end of this past fiscal year, pandemic support that was provided by the federal government for child care, is a lot of it's disappeared. So as veterans are working for jobs or going for medical care, we envision that there's a potential that they might need that money. Additionally, we have one facility that I'll talk about later, Pamlico Rose, that actually provides treatment and is focused on female veterans. We want to support those folks. At the last governor's working group, I was at the rural engagement event for rural partners in North Carolina in Wilson. And I've been also working with the VA Office of Rural Engagement, met with Laura Zimmerman from the VA's Office of Rural Engagement there, and we've started a dialogue. Rural Partners Network, I'm in contact with George Fatal, who's one of the big supervisors for them, headed Eastern Carolina. In that particular session, one of the most interesting things that happened is I met up with a representative from the North Carolina Office of Information Technology, and he talked about the recently funded broadband contracts in Eastern North Carolina. And the counties in our group, $23 million funded, with another $10 million in matching funding required from the recipients. So if you're in Martin County, you just lost your hospital. Telehealth needs good broadband, and out in some of those rural counties, it's pretty bad. So with those dollars going into broadband expansion in the rural areas, big plus. Whether you're trying to access a VA telehealth, military hospital telehealth, or the Martin County folks, another doctor, or if you get into Greenville, it all works and it's very critical. I've met with the Pitt County manager, several of our representatives. That's Janice Gallagher. We spent 2 hours with her, and we've got an appointment in about a month to meet with her again. She made several suggestions to help the DAV and the American Legion. So constructive session, we're continuing that dialogue. Pamlico Rose, this is a group that's created to help female veterans who are having problems transitioning out of the service into civilian life. They are willing to address problems of alcoholism, drugs, and suicide. The construction's complete. You see their main facility. They'll be able to hold female veteran retreats and sessions to help resolve those issues. They just finished creation of their barn which right now the Al-Anon group of Washington, North Carolina is using for their weekly meetings. They can do yoga, they can do art training, they've got wood shop. They can do all different kinds of therapies in that facility as well as in their gardens outside. Like I said before, we're waiting for the grant results. Everything we requested is to reduce stressors. So is it going to be a final answer? No, but if we can help provide food for veteran family, great. If we get some money for hyperbaric oxygen treatment for TBI and PTSD, one of our members worked with Don Davis to get the initial funding from the state of North Carolina a couple years ago, and this would enable additional veterans to get treated. Rural Engagement Office, like I said, met with Laura Zimmerman. I'm working with her and her boss to get more focus in some of the VA conferences on rural issues. That hasn't always happened. So that's what we're working on. And Pamlico Rose, their Women's Veterans Retreat really will start coming on about the 4th of November again. That's when they have their grand opening. And they, like I say, they will do the training and work with those women veterans, which from having participated in some of their webinars before, there is a huge need. And these folks are trained to work those issues. So that's what's coming next for us. And I appreciate your time, and thank you very much. I don't know that. The question was, how do you refer a woman? I can provide the name of the president and director of Pamlico Rose, and Robert Sands.
So needless to say, I'm part of it. So they're not quite officially open yet, and we're working on a process of referral. So I'll let you know as soon as that is official. But I'll be speaking at the soft opening on November 4th.
Yes, they've slipped their soft opening, and they're having a grand opening, but great. All help for those folks is the work they're doing is really wonderful.
Yes, I was at the initial retreat. It's very beneficial, very beneficial.
Sure.
I want to add, I spent 15 years working on the Greenville Center. I'm very familiar about that, Eastern North Carolina. There's a huge need for VA resources. They need everything.
My prime contact with the VA in Greenville is Anastasia Smith, the
I hired
director
her.
of the Vet Center.
But there's another population that we're not focusing on. There is a huge veteran population that's in the prisons and they're transitioning out. They need resources. There's a huge veteran population that's in Eastern North Carolina that's transitioning out. And I want to thank Lucas, who brought that to my attention about 6 and 7 years ago, about going into the prison system and working with those veterans. We cannot forget those veterans because they're transitioning back into our communities with no resources. So not only we talk about Eastern North Carolina and rural veterans, we cannot forget about our veterans that's in prison. So thank you.
Hey, thanks for bringing that up. Lucas, I know you've been in the department several times. Just as a heads up, that's been a clearly identified shortcoming across the state. our transition services director, who Lucas, I believe you met with, Andrea Allard. She's partnering right now with the Department of Adult Corrections Chief Deputy. They have just now stood up in an office within adult corrections, but specifically to serve that veterans community. The department and adult corrections is in the foundation level. I'd love to bring you both in, talk about it a little bit more, but there is a highlight on that, both from adult corrections and DMVA. So I think we'll have a better resource for our incarcerated veterans as they transition out.
So just wanted to real quickly add, and thank you all for everything that you're doing, for being here. Thank you all for organizing it. So when we're talking about veteran suicide, when we're talking about an overdose epidemic, folks coming out of carceral settings are at a much higher risk for all of these things. And so it's really important that we don't wait for our brothers and sisters behind the walls to come home, that we go in and let them know that they're not forgotten and help them tap that resources. And it's not on the state NCDMVA, it's not on the county VSOs, it's not on Charlotte Bridge Home, it's not on federal VA. It's on all of us. It's on all of us to make sure our nation's sheroes and heroes behind the walls are not forgotten. Thank you.
So something I want everybody to capture out of this is, number one, this collaboration is happening because of the North Carolina Governor's Working Group. This is something that's within the group. This is why the group is here. North Carolina Governor's Working Group and the Governor's Institute. Phil, thanks a lot for your comments. We've talked a lot over the last year, a couple of years, about community veteran engagement boards and the subcommittees we have on different things. Phil's representing what we need community engagement boards to do. They're actually going in, designing programs and doing things in their community. Now, Phil's community is 17 counties long, but we've got the Blue Ridge Consortium, Lee Tabor's crowd. We've got the Wilmington, we've got Fayetteville, we've got all these communities. These are the things that Secretary Gaskin is really up about, and what we want to do, get with these community veteran boards. Go out there in your community, figure out things. This Pamlico Rose, this sounds like an incredible program. It's part of how our communities are responding to the veterans in their communities. So Lucas said it. It isn't about anybody, it's about everybody. That's why we need to get our communities together. That's why our communities are the key to how veteran services work. So that's why county commissioners, mayors, the governor's challenge, the mayor's challenge, all these other, every component of that has to get dealt with and brought together to make us have a program. So I want you to really think about, as you're interacting in your community, get those partners and start talking about events at a community level, not at an individual level, not at Veterans Bridge Home level, but at a community level to do things with. Thanks.
All right. Are there any more comments or questions before I go on with the announcements and upcoming events? Here's one.
Hi, my name is Vicki Smith with Infinite Beginnings, and I'm a behavioral health provider within North Carolina. One of my primary frustrations is being able to provide services through the VA. I've been presented with a number of roadblocks, and there is no designated person for me to communicate with so that I can provide services. Is there someone that can help me with this?
Would you like to take that question?
through the process. So
I have, and I'm sorry, I don't have the contact information in my on my mind right now, but I can connect you, so I'll get your card. But they're trying to make it easier. The VA knows that they're invested in community care, and they absolutely need good providers like yourself in the community who want to see our veterans. So I will get you connected.
There's also a VA Pathfinder website, if you just Google VA Pathfinder, that helps streamline contracting with the VA. It's a new resource, it's phenomenal.
And hi, I'm Mary Parker. I'm the Deputy CMO for Vision 6. I would love to speak with you and connect you to the right facility and the right individuals there. Our care in the community department is not perfect, but it is getting better. And the most important thing is we cannot leave veterans in uneven waters. Thank you.
Sounds like the working group works.
I think the working group does work. That's what it's all about, connecting people. And providers are so needed across the state, especially in eastern and western North Carolina. Those individuals would love to use community care, but the providers are just not there. So I know that the VA welcomes new providers, and sounds like you can get connected with them through the Veterans Governor's Working Group. And yes, NC Serves. We could connect you through NC Serves. All right, so some upcoming announcements. I'd just like to piggyback on what Lucas said about our incarcerated veterans. There is a misconception that those individuals are not eligible to receive their benefits, but there is a way that they can receive their benefits if they are eligible, and there is a way that their families can receive their benefits while they are incarcerated. The VBA, Veterans Benefits Administration, has a good guidebook online for justice-involved veterans, and you can always reach out to me as well if you need to know how to go about helping that veteran to receive the benefits that they are entitled to, even though they are incarcerated. All right, mental health first aid, we talked about today, and it looks like the next in-person classes are going to be November the 14th, 15th, and December the 7th in Fayetteville. You can email Alex O'Neill with the Governor's Institute for more information, and the link to her email is there. Mental health first aid is, I did mental health first aid many years ago with Partners Behavioral Health Care when I was in Hickory. It is very enlightening, and you can take these over and figure out something, or something will become more clear every time you take those classes. NC Strive, yay! These are one of my favorite events taking place, the Student Transition Resource Initiative for Veterans Education. That's going to be in March of 2024 at the Tally Student Union at NC State University. This event brings together not only veterans and their spouses who may be using VA education assistance, it also brings in the children of veterans. We found out at one of the NC Strive events through an expert panel of children who had grown up in the military that they have a really hard time transitioning to college because a lot of times they are in schools all over the country and sometimes all over the world. So you learn a lot at NC Strive. A lot of good providers show up there, and we welcome you to sign up to be a vendor if you would like, and come out for that in March. All right, VSS. This is one of my babies. Dave and I and a wonderful group of individuals worked to get VSS off the ground back in 2014, 2015 with NCDMVA. And the upcoming classes are going to be January the 12th and May the 3rd. So there's 2 in-person classes. And in the East, January 19th and May 10th. So the West class is going to be in Salisbury, North Carolina, very near to here. And those 2 in-person classes, you'll get an introduction. You will do a modules of classes in between on your own. It's a self-paced, self-learn, and then you'll do the final day of class and graduation. So again, in the West, it's going to be January 12th and May the 3rd, and in the East, January 19th and May the 10th. And enrollment will open October 30th. I will put it out to all the VSOs, and we will share with all of our distribution list. If you are on the Governor's Institute email or NCGWG email list, you'll get a notification when that opens. Please join. All right. More powerful than a locomotive. I like it. Join us. Our next North Carolina Governor's Working Group is going to be January the 25th, 2024 at the McKimmon Center at NC State University for the first public meeting of 2024. That doesn't mean we won't necessarily see you all again before the end of the year, because we will have subcommittee meetings, and we'll be getting together to plan. So look out, you might get an invitation to come join us as we plan for 2024. And please register for those email updates so you can stay abreast of all the things that are coming down the pipe. You always can join us by live stream on Facebook. We hope that everyone out in Facebook world was able to join us and keep up with us today. There is closed captioning available, and again, meeting agenda and minutes, and our entire presentations available at ncgwg.org. Minutes and group updates. And if you just happen to be a veteran who has not been to see a VSO and you don't think you're eligible for benefits, or you were denied benefits many moons ago, please go to milvets.nc.gov under Benefits and Services, Benefits and Claims, and there is a interactive map of North Carolina. You can find your state and local county VSO there. Please go find your VSO, call us, and come see us. Any alibis before we close out today? All right, seeing none, thank you all so much for joining us, and we look forward to seeing you in January. One more, got one more.